help you with this, you'll get a prescription for narcotic pain medicine. I will start you on a specific dose, which will be on the prescription and thus the bottle, but I'll also tell you a maximum dose you may increase this to. It's important if you do increase the dose to do it slowly, watching your child's response to the medication. Our goal here is to keep them comfortable without giving them too much medication. The narcotic pain medicine seems to peak in effect about 30 to 45 minutes after you administer it. If you're having trouble getting your child to drink, give the medicine, wait about 30 to 45 minutes, and then over the next 30 to 60 minutes, when it is working its best, work real hard with your child to get them to drink as much as they can, in effect, tanking them up. The prescription pain medicine I'm giving you has Tylenol in it, so only one or the other may be used every 4 hours. You may, however, use Motrin, which is given every 6 hours. Motrin will not interact with Tylenol or the narcotic pain medicine I am giving you. It helps with the pain, but it's also an anti-inflammatory, which helps with the post-operative swelling. You'll also go home on a prescription for Zofran, an anti-nausea medicine. I would not fill it, I just like you to have it as a backup. About 68% of children vomit once after surgery, so I wouldn't worry about once, but if you hit 2 or 3 times, definitely get it filled and administer it. It should take care of things until tomorrow, when anesthesia has completely abated. The sore throat your child will have will peak and trough over the next week. Often, the day after surgery is worse than today, and day 5, 6, and 7 are often worse. That's when inflammation seems to peak as part of the healing process. This is all normal. If you give some Motrin day 5, 6, and 7, that will be very helpful. Ear pain is also common after surgery. It's coming from or referred from the throat. Stiff neck, bad breath, also normal. If you look at the back of the throat, you'll see yellow or white scabs where the tonsils came out. This is normal. This is where the bad breath is coming from. Fever is also common and is normal as long as it's brought down by Tylenol and Motrin. Please call us for a fever greater than 102 degrees. That does not come down with Tylenol and Motrin. Bleeding can occur after surgery at any time, but is usually day 7 to 10. It occurs when the scabs in the back of the throat fall off. If you see a teaspoon of blood or more, please call or bring your child to the nearest emergency room. To limit bleeding, please have your child refrain from any strenuous physical activities for the next 2 weeks. Anything that will get your child's heart rate or blood pressure up will increase the risk of bleeding. Thus, generally, 1 week out of school is sufficient, but 2 weeks from recess, gym, and sporting activities is necessary. Later today, you'll begin with a clear liquid diet, so water, Gatorade, different juices your child likes. Generally cool as opposed to real hot or cold is best. You should try to stay away from acidy, spicy things like grapefruit juice or tomato paste, tomato sauce. Later today, soft foods are okay. Jello, pudding, mashed potato, applesauce, mac and cheese, yogurt. If you'd like a treat today, ice pops are the way to go. Ice cream and heavy milk products often don't sit well with anesthesia and they're best left until tomorrow. Generally, you'll need a week of a soft diet. You should try to avoid sharp stuff in particular for the next 2 weeks. Brushing teeth, just need to be a little careful in the back. A non-tartar controlled toothpaste will feel better than standard toothpastes. I hope this was helpful in providing you the information